Ruth Maguire, to be followed by Annie Wells.
Presiding Officer, the Public Health Scotland report published last week highlighted the issue of care home size on the spread of infection. Can I ask the Cabinet Secretary how the Winter Plan helps minimise staff movement within and between care settings to reduce the risk of transmission?
Cabinet Secretary.
Yeah, the question of care home size was highlighted certainly in that report. It's also there in our evidence paper. It's been there in other emerging areas, including the care inspector. It's not a straightforward question to answer because a care home is the size that a care home is. We are about to enter discussions with providers of those larger homes about what they need to do in order to try and cohort both their staff, so that sometimes these care homes are in 2 floors, so that we have a bubble of staff that don't move between one floor and another. That we try and, as we do in hospital, cohort individuals who are COVID positive. So again, we're trying to minimise the mix between those residents who have the virus where there is an outbreak and those that don't, in order to provide clinical care where it's needed and protection where it's needed. Inevitably, some of that will produce an additional financial requirement, and that is part of the additional 112 million that I've spoken about in my statement, which is additional to the additional 150 million that I've announced previously. So we're looking at £262 million in addition to what was already in the Scottish budget for social care. But we need to work through individually with care home providers of those larger homes exactly what they need to do and how we can assist them to do that in order to address the concern that is around about the size of care homes and the movement of staff between care homes.